Senator McCarthy.
Thank you, Mr Acting Deputy President. I rise to speak to this matter of public importance, and it is very important, the issue of Foetal Alcohol Spectrum Disorder, or FASD, which is often referred to as the invisible disability, Mr Acting Deputy President. But I share with the Senate that as far as my families and clan groups are concerned, it's not so invisible. Unfortunately, it's a very visible part of our daily life, a very visible part of the community life, a very visible part of the educational system trying to deal with students across the Northern Territory, but in particular in our remote communities who are suffering from the FASD. FASD refers to the spectrum of foetal outcomes linked to alcohol use during pregnancy, and it may include physical, cognitive and/or developmental symptoms. It's often not noticed until the child reaches school age, and their learning and how they relate to their peers becomes apparent. The majority of children and adults who have FASD live with significant cognitive, behavioural, health and learning difficulties, which are lifelong, Mr Acting Deputy President. And unfortunately, a lack of research and data means we do not have a really clear picture of FASD prevalence in Australia. That's from an academic and research perspective, but I can certainly tell the Senate that there are very personal stories and information just in the Northern Territory alone, and I'm very aware across WA and Queensland of the concerns around FASD. It's believed up to 500,000 Australians could be on this spectrum. What we do know from the AMA is that FASD is not an issue that is confined to a particular community or demographic. It is a disorder that crosses socio-economic, racial and educational boundaries. We also know, Mr Acting Deputy President, that alcohol consumption statistics and epidemiological data on FASD prevalence from comparable countries suggest that FASD prevalence is higher than previously thought in Australia. In the US, for example, it's estimated that FASD affects roughly between 2 and 5% of the population. The AMA also tells us that in some high-risk Indigenous communities, the prevalence may be as high as 12%. This disability is entirely preventable, and this is where our main efforts need to be focused, Mr Acting Deputy President. Again, in my home of the Northern Territory, the lack of reliable data means we don't know much about how many children and families are affected, but we do know from the 2015 Australian Early Childhood Development Census that some 37% of children in the Northern Territory were considered developmentally vulnerable across one or more domains. In some communities, it was as high as 50%. Experts also estimate that in Central Australia, 1 in 5 children could suffer from FASD. 1 in 5. Again, all are entirely preventable. I'm pleased to say in April last year, the Northern Territory's first diagnostic centre for FASD opened in Central Australia, and the centre, opened by the Central Australian Aboriginal Congress, helps ensure early diagnosis and immediate access to services. Early intervention and support improves psychosocial and behavioural outcomes for those affected by FASD. And wraparound services, Mr Acting Deputy President, such as this provide important support for children and families. In Darwin in May last year, Aboriginal Peaks of the Northern Territory, APONT, hosted a landmark top-end forum on FASD. That forum brought together 180 delegates from 37 organisations across the Northern Territory, including Aboriginal leaders, FASD experts, Aboriginal community-controlled organisations, government representatives, medical professionals and non-government organisations. That forum heard from specialist neonatal and general paediatrician Professor Dr. Mantho Kosi-Mang. She spoke of her experience as a paediatrician in the Northern Territory and said the common effect that she sees with children affected by FASD is that they are born smaller than they should be. These children end up staying for a prolonged period of time in hospital, whether it's in the Darwin Hospital, the Catherine Hospital, the Tennant Creek Hospital, Alice Springs or Nhulunbuy. Our children are spending way too much time in these hospitals. This prolonged hospital stay also affects family members who may then be separated for longer from kin, culture and community. For remote communities, access to a paediatrician might be at most once a month, for example, in larger communities like Malarndirri. But what about the smaller communities, like in Yarralin? They may only get a paediatrician every 3 to 4 months. In between, they are seen by GPs, who again may just be visiting for a number of weeks. Aboriginal medical services and Aboriginal community-controlled health services have a key role. They have the key role in playing for change, driving change, Mr Acting Deputy President, in our communities. FASD also increases the likelihood of a person coming into contact with the criminal justice system, and we've been hearing that from other senators here speaking to this MPI. Canadian research has found that people with FASD are approximately 19 times more likely to be arrested than their peers. And here in Australia, Dr James Fitzpatrick, a paediatrician and researcher working with children who have FASD, said 36% of people in juvenile detention in WA had the disorder. That's just in WA. Not only would early diagnosis help get children listed on the National Disability Insurance Scheme and accessing support, he believed it could help lower prison rates. Early intervention can provide the skills that reduce the likelihood that an individual with FASD will come into contact with the criminal justice system. Furthermore, it is vital that these interventions are culturally and linguistically appropriate. Let's remember, in the Northern Territory alone, we have over 100 Aboriginal languages. Dealing with issues such as FASD also rely on a willingness to take strong action overall on alcohol-related harm. The extreme levels of alcohol-related harm in the Northern Territory are well documented. Updated research from the Menzies School of Health Research indicates alcohol-related harm costs the Territory upward of $1.38 billion per year. We know alcohol-related harm is hurting the Territory both socially and economically. For this reason, the Northern Territory Labor Government introduced the most ranging alcohol reform agenda in the country. The Anti-Alcohol Harm Minimisation Action Plan 2018-19 was introduced nearly 18 months ago as an evidence-based approach to tackle alcohol-related harm, and the plan is focused on delivering generational change through alcohol reforms. Mr Acting Deputy President, 75 of the 219 recommendations are complete, and significant progress is being made against the remaining recommendations. There are some early positive results from the reforms, with reductions in alcohol-fuelled assaults, domestic violence, antisocial behaviour and emergency department presentations, a really critical aspect of monitoring these steps in this action plan. NT-wide emergency department presentations have reduced by 24% in December 2018 compared to 2017. Non-government organisations, community groups and industry are closely involved in the successful implementation of the recommendations. A major problem in many NT towns and communities is the secondary supply of alcohol. Coordinated measures such as the Banned Drinkers Register is stopping problem drinkers from accessing takeaway alcohol. So, Mr Acting Deputy President, it is critical that the Parliament of Australia be acutely aware of FASD, be acutely aware of the significance that thorough research still needs to take place in our country to assist families and their children from this disease that is curable.